Hi, my name is Amanda Panacea, and you're listening to the Healer Revolution podcast. This is a community for self-healers, biohackers, practitioners, and any other helping professionals. You're in the right place if you're seeking conversations about how pain becomes passion, the connection between physical, energetic, mental, and our spiritual self, finding your body's ancient wisdom, the latest biohacking technologies, clinical research, and if you just want to nerd out about complex biochemistry and quantum physics. But this is also for entrepreneurs who seek infinite abundance and a supportive community. So pour a cup of King coffee or Sisters tea and let's join the revolution. Hello, everyone, and welcome to the Healer Revolution podcast. I am so thrilled today to have you guys listen to my conversation with my friend, Dr. Stephanie Canestraro. She has an extensive and impressive education history, graduating from honors from the Canadian Memorial Chiropractic College. She also has an Honors Bachelor of Science degree with a major in Biochemistry from the University of Western Ontario, as well as completed the Contemporary Medical Acupuncture Course at McMaster University, as well as Biomedical Dry Needling. She also has been certified through Functional Medicine University and recently became a member of the prestigious Institute for Functional Medicine Practitioner Group. She had her own chronic illness journey that really brought her into this integrative approach where she treats her patients using a number of techniques such as contemporary medical acupuncture, joint manipulation, ART, custom orthotics, facial abrasion, Graston techniques, and performance optimization taping techniques. So without further ado, welcome to the show. Hi, everyone. Thank you so much for joining me today. I am super excited to be sitting here with Dr. Stephanie Canestraro. We have been Instagram friends for a long time, and I'm finally get to sit down with her and get to know her a little bit better. So thank you so much for joining me.
Thanks for having me. I know we've been following each other's stories, and I feel like we're kind of always on the same wavelength. It's like I watched like something the day before, and then you did like a good post about it, and I'm like, we're like kind of always like. And then you mentioned like, I don't know, one of it was like LDIs and I hadn't heard of it. And then like a few weeks later, that's what got suggested to me. Like, it's just kind of, yeah.
Yeah, that community is like that. I feel like there's themes of waves that come through like our Instagram little community. But today I really would like to get to know you a lot more as to how you got in that space and what like life journeys kind of led you into working with other people.
Yeah, for sure. So, I mean, I always knew I wanted to be in healthcare, and I was actually in chiropractic college when I got really sick, actually. And as a kid, I was the kid that was always like, eczema. Like my parents had to like use like cloth diapers instead of like no plastic could touch my skin. And that was like in the 80s when that wasn't a thing, right? I couldn't drink from plastic bottles. Like, so I always like was pretty kind of reactive, had stomach issues earlier, had like, motion sickness, but still overall like healthy kid, things ebb and flow. But it was the end of chiropractic college. And it was kind of like that story where, it's always the perfect storm, like stressed with exams. I had helped switch my grandfather's surgery to get him in faster. And then he almost died and I was blaming myself. Like all of this stuff came down and it kind of was my first like really bad flare of bad health, which I didn't know what was happening to me. I now know, just recently really figured out what it was, but it was Lyme disease. But then I had underlying celiac disease. Like, so I had like severe gastrointestinal issues to the point of incontinence. I had, my hair was falling out in clumps. Then I started having severe neurological symptoms. And I think that's when the Lyme came in and no one could help me. And I was in and out of the hospital. And then I was medicated with metronidazole, which I reacted to because they didn't realize it was celiac. They thought it was an infection or there probably was an infection, but regardless, it was the wrong thing for me, because then I ended up getting acute pancreatitis. And so, it was just like this like spiral out of control really with my health. And even like the other like chiropractors at the chiropractic college, and even like some of the naturopaths, like I just didn't feel like people were really like either listening or grasping what was going on. And I knew there was something more. And my neurological symptoms started getting worse and worse. And that's when I was told like it was a tentative diagnosis of multiple sclerosis, because I had Bell's palsy one day, then I was dizzy, then I was numb on one side of my body. So they did a brain MRI, and there was, some white matter, like plaquing that they say, but not enough that it's MS. So that's why it was like a tentative diagnosis. And so that kind of sent me on my journey into functional medicine. And I found Dr. Terry Walls at that time. And it was like, wow, so like listening to her story, she was in a tilt recline wheelchair, healed herself, like, with nutrients and changing her diet. And, probably at the same time, she didn't even realize like starving out the pathogens, helping your immune system catch up, clearing some, I don't know, just like I was eating like a normal standard diet at that time. Like I didn't know I had celiac. So that's how I learned. And then I went into functional medicine. And then from when I left chiropractic college, I was already like in contact with treating a lot of athletes. And I would openly share my story with them. And they would, also start to open up to me and be like, oh, well, my stomach's not great. So then I would start like testing them and finding parasites or whatever. And it kind of grew from there to kind of like optimizing for them. And like the whole, like, because like how, my neurological system. So the whole like gut brain connection for me, because my gut was such a disaster. And then I was getting plaques in my brain. I couldn't think. I would just tap my head and I would have a concussion. So that's how I got into like the whole like vagus nerve stuff, and why my clinic's called the Vagus Clinic. And then, working with these guys who have concussion symptoms, like starting to tie in the whole vagus nerve in the gut, which was being overlooked for them as well, even though they're on elite teams. And now just working with everyone, because as you know, like there isn't too many root causes that cause people to feel unwell. So it's just like investigating and kind of peeling back the layers.
Yeah, totally. Yeah. And I love that your clinic is called the Vagus Clinic. So if you could just briefly explain like what the vagus nerve is, I think that would be really helpful.
Yeah. So the vagus nerve is a cranial nerve. So it's our 10th cranial nerve. And that means it's a nerve that comes from your brain or the brainstem. So the vagus nerve comes from the base of the brainstem, and it exits and it innervates all of your organs. It's the longest. They're called parasympathetic nerve in the body, and parasympathetic refers to our rest and digest side of our nervous system. So it's our healing side of our nervous system that it's in charge of. It's, controls our immunity, lowers inflammation or regulates inflammation. It's in charge of like digestion, so the migrating motor complex, so the moving down of our food. So when you're constipated, your vagus nerve isn't working properly, as one example. It innervates your heart. So one of the ways people can see how well their vagus nerve is functioning is through something called heart rate variability, which is the difference. The variability in between heartbeats shouldn't always be beating in the exact same rhythm. It should be and timed differently in between. So that's called coherence. And people can measure that with, Aura rings do that now, iWatches or whatever. Like there's multiple different like wearables that you can utilize. For years, I've used heart math. It's like the one that you attach to your phone and it just attached to your ear. But now people are doing things where they're assessing like, the nervous system in so much more detail, like with these like metal things on your ankles, and they get the whole kind of vibration off your body, and they can tell you what percent of sympathetic, parasympathetic. So sympathetic is our fight or flight side of our nervous system. So that's where most people are living most of their lives, like stressed out. And like, we're the only mammals on earth that are able to throw ourselves into the sympathetic state just by thought alone, or by, scrolling through Instagram these days. Right. So, I always like really focus on people trying to do things to stimulate the vagus nerve, because it is such like we're just so stimulated and everyone's like just so busy. And, there's been somewhat of a slowing down, but because people have been forced to stay home, at least in Canada, more than where you are. So, in some ways, but then there's just all this division and polarity. And I think that people's vagus nerve is suffering even more, right? And then even the virus affects the vagus nerve. So yeah, I think it's an important topic.
Yeah. And it's something that really came to my attention only in the last year or two. And I became a therapist like 12 years ago. Like we did not learn anything about the vagus nerve in the grad school program that I went to. So, I mean, the work of Dr. Stephen Porges on like polyvagal theory, I think is getting a lot more attention now. Hopefully, I'm sure they're teaching this more so in grad school programs now. But if you see a therapist, that went to school 10, 20 years ago, unless they're doing continuing education on the science and some of this research that's coming out now, they may not have learned about it, or they probably didn't learn about it.
Yeah. The polyvagal theory, that was pretty groundbreaking when I was reading about that too, because, it made so much sense, because you're like, okay, I'm working with these athletes. They're clearly not like, they're not in a frozen state. They're like in the sympathetic nervous system, but still they weren't regulated enough. Anyways, I really am into all of his research.
Yeah. And you mentioned hacks to stimulate your vagus nerve. What are some of those? Because I know that there's some really easy things out there, but there's also some really powerful like things you can do at home that people just might not know about.
Yeah. So because the vagus nerve innervates so many different things, including like the back of our palate, like the soft palate. So just like gagging, humming, like those gargling, those kind of things activates your vagus nerve. And you can think of it like you're doing a workout. So the more you do it, like the stronger or the more like activation or blood flow the vagus nerve gets. There's, different eye motions or face postures. So far gazing is one of them. So if you just gaze as far as you can to one side and hold it for 15 to 30 seconds, and then you can gaze to the other side and do the same thing, it pulls the same fascia that's kind of connected to the vagus nerve. So it gives some like blood flow stimulation, sound, listening to different sounds like 528 hertz, which you can look up like binaural beats, all of these things just going on YouTube or something. And you can listen to those different sound therapies, and that's going to turn on help stimulate the vagus nerve. I came up with through my own experiences of panic attacks, mostly on planes. I had a toothpick because I do acupuncture. I used to teach acupuncture as well. And so I started tapping some acupuncture points, but your vagus nerve is most superficial over the tragus of your ear, which is this part right here on the outside. And so I started tapping there, but then I realized there were different spots on different meridians, in your arm. So right at your elbow. So people would see me on the plane, just tapping away, and tapping your scalp helps. And so I started just doing little studies on myself, and I would put on the heart rate variability monitor, and I would tap these different places, and I would see how powerful it was at regulating my vagus nerve or my heart rate variability, which is, and I could already tell it was helping me because I was feeling calmer. It was getting me out of kind of the tailspin. And you can compare it to EFT, but it's with it's just a little with the toothpick because it's such a small surface area. It's just even more powerful, I think. Yeah, things like cold therapy, even just putting something cold over your face, cold showers, cold plunges, if you're ready for those. I mean, some people, if their nervous system's really bad, those can be too much, right? So you kind of find what works better for you. Yeah, so those are a few. I'm missing some. There's essential oils you can smell. Those are a lot of them, but then there's ones where you can actually stimulate. There's something you can attach to your ear and you can actually add electrical stimulation. So those are vagus nerve stimulators. They even do implants on people who are really sick. And they see them going into remission from autoimmunity, rheumatoid arthritis, or because when you stimulate the vagus nerve, it actually changes your actual gut microbiome. There's so much crosstalk back and forth with the vagus nerve to the gut, and the gut has more nerve endings than our spinal cord. And it's just, so it's really powerful. It's a powerful, probably overlooked thing, like you said, that these little daily habits that can help us a lot. Red light stimulates your vagus nerve as well.
Yeah, I was going to ask you your opinion on those implants, because I've actually been seeing that a lot more in the mental health community, like clinical trials for implants. And I'm like, is there a better way to do that without the actual implant?
I think so. And, you know, I mean, obviously that kind of starts to seem barbaric. I mean, most people, that's going to be like your last resort if you ask me, but I don't know, that's the way they go. I don't know. But it's still cool that reading those studies, and I'm not suggesting people like go through that invasive thing for sure. Something else I just got done on myself was neural therapy injected around my vagus nerve, which was very helpful, because what I didn't mention is that, you know, I said I had Lyme disease in the past, and I didn't really know, but I just recently had like a pretty aggressive Lyme flare that kind of hit me out of nowhere. And that tool has really kind of helped regulate my nervous system.
That's awesome. I was actually looking to get that done in the community too.
Really?
Yeah, I made some phone calls. Could you explain what neural therapy is? Because it's actually totally different than what you think it is.
Yeah, 100%. So neural therapy is actually like an injection therapy, or a prolotherapy that they call it, but you can use different substances, but most of the time they're using procaine. Procaine is, you know, people can think lidocaine, novocaine, those kind of things they use to freeze you at the dentist, but procaine is the more natural version, or what those are based on. So it's actually a really poor numbing agent. Like, it doesn't work quite well. It's like 15 minutes, but what happens is it turns into all these B vitamins, and then it has a big, huge anti-inflammatory effects. So the idea behind it is that in our body, we have different interferences, and those can be from, like, specifically from scars or from injuries in the past, or, you know, just even sometimes just tension. But a lot of the times people will use muscle testing or some sort of testing, or even just like a history, or if you can see actual scars, to see like where to actually inject. And it also causes a lot of drainage. So like moving lymphatics, which is like a big part of most people who aren't feeling well, you're not having good lymph drainage. So, and then they inject those spots with procaine, or sometimes other things. Sometimes people say even saline. It's just the act of, like, you know, injecting those points, stretching like the area, just gives feedback to the nervous system. And then, yeah, there's like, so when I got it the first time, because there's a big point, it's the back of your tonsils. I didn't do that one yet, but they did my thyroid, and then they did an IV, because I was kind of nervous about it. And I've had this chronic sinusitis, like Marcon's kind of thing. And I just started clearing stuff like crazy. And I felt calmer than I had in months. So I trusted the guy, went back, and we did a lot more this time around. So I really like it. It really pushed the needle for me for feeling a lot better.
That's awesome. Yeah. So I know that you recently posted about your recent Lyme flare. It's one of the topics that's really, I feel like, not talked about maybe with Lyme, is that Lyme Carditis and what that is. I've had a lot of clients diagnosed with all sorts of heart conditions that had absolutely no clue. So can you explain what Lyme Carditis is?
Yeah. So Lyme disease is an infection with, people think it's from ticks only, but it's not. And it's with a bacteria called Borrelia burgdorferi, but there's other strains. That's just the main one that they'll actually name as Lyme disease. So, you know, you don't just get it from ticks. I think, like, you can get it from your sexual partner. You can get it from anything that bites. I mean, even some co-infections for Lyme you can get from your pets. So, you know, it's definitely something that needs to start to, like, more light needs to be shone on it, because it's definitely being overlooked in a lot of people. So Lyme carditis, Lyme is because it's a spiral, it can affect any part of the body. It can go into your joints, you know, and it can go into the lining of your heart. And some of the co-infections can go in the actual heart. But if it creates enough damage, then it interferes with the electrical output of the heart. And it does that in more ways than one than just the mechanical corkscrewing in. And if it gets bad enough, for me, I had severe tachycardia. I had PVCs, PACs, like, which are premature ventricular contractions, but they were intense. Like, I've had heart palpitations before, right? That's what those are called. Lots of people have felt them. Almost feels like a skip of a beat. And, they'd happen here and there, and then they'd disappear and I'd go on with my life, right? So it was like those times, like, just, they were so intense and they were causing like dizziness, wooziness. I thought I was going to faint. I actually would have fainted once if my husband didn't lay me down. So that's when it's starting to like interfere with the actual conductivity. And if it goes on long enough, which no one was taking me seriously. So if I didn't do my due diligence and I had to take an antibiotic, which I haven't in like 15 years, and get that, and it took away like the heart pain right away, because I had pain in my heart, pain down my arms, numbness in my hands, it can turn into what's called a heart block, and that can kill you. So because you don't get enough of the electricity going from the upper chambers to the lower chamber of the heart, and it can stop. And it's so your body tries to compensate because it'll actually slow your heart, and then your body tries to make it go hot, like up, and then it goes too high, and there's a whole dysregulation.
Have you had to give up coffee for health reasons? Maybe because of the stress it was putting on your adrenals, maybe because it was messing with your sleep, maybe because you felt terrible after drinking it, or maybe because you were told coffee had mold on the beans and you needed to stay away from mold. Well, what if I told you there's an organic, mycotoxin-free, quality coffee that contains reishi spores or Ganoderma lucidum? Ganoderma lucidum helps to modulate your immune system, adapt to stress, balance hormones, and doesn't give you the jitters or shakes like regular coffee used to. Sounds too good to be true, right? It's called King Coffee by the company Organo. And King Coffee came into my life when I was struggling with chronic hives, full body eczema, and mast cell activation syndrome. I hadn't drank coffee in years because it made me feel anxious, shaky, and clammy. So I had no expectations that drinking King Coffee would be any different. However, I decided to give it a try after seeing lots of amazing practitioners talk about the benefits of reishi online. I tried a 7-day sample and the chronic hives were gone by day 5. I was in shock. After that, I dove into the research on reishi and found that there are over 3,000 peer-reviewed PubMed clinical trials using reishi Ganoderma as an intervention. The company Organo also has a patent protected on their harvesting process. They double crack open the spore shells, which makes them up to 80% more potent than the body of the reishi, which is usually used in other reishi products. This also makes the spores 90% more bioavailable for your body to use. If you would like to try King Coffee, visit thehealerrevolution.myorganogold.com, or for a 7-day trial, you can check out my link tree on my Instagram at Amanda Panacea.
So yeah, it needs to be treated and the heart needs to be supported as well. So there's a lot of things that I learned about that as well, because I hadn't heard of all of this stuff happening so intensely. And now, obviously, since I started posting about it, like, people are reaching out to me with those issues, but it's crazy to me. Like, and I started doing research because I'm like, why now? I felt completely fine. I even said to my friend, like, I feel the best I have in 15 years or whatever it was. And then shortly after I crashed, and they had just rolled out 5G, which, your heart's electrical. So if you're adding a whole new frequency to the earth, I mean, some people are going to react. And so it's shown that it can make your cells detox, and Lyme can lie dormant in your cells. It can create biofilms and be in different parts of your body, just in hibernation for a long time. So I think it's not just a coincidence that it's all kind of coming out now.
Yeah, that's such good information. And when I was going through topical steroid withdrawal, I started having really insane heart palpitations all day long. Like, my heart was beating way too fast. And there were multiple times I almost went to the hospital, but I was like, what are they going to do? Give me propanolol? Like, they're just going to give me something to lower my heart rate. They're not going to do anything. And the thing that actually helped me at the time was doing frequency specific microcurrent for the vagus nerves.
Amazing. With the little one that you have?
I found someone in the community. You can go to frequency specific microcurrent.com, I think. And it'll give you a list of practitioners. And she had like 6 or 7 machines. So they hook you up with all the electrodes and you lay there for like an hour. It's really relaxing. But I mean, within one session, my heart rate came back down and it was life-changing.
See, I had a little frequency specific microcurrent that I used to lend out to different athletes, and I never got it back one day, but I need to get another one because it is a good tool and that does help for vagal nerve stimulation. So yeah. All the like frequency interventions, my partner makes fun of me and is like, ooh, frequencies. But I'm like, this is literally the only thing that brought my heart rate down. Like you were with me, you saw what it was doing to me and it worked right away. So yeah. See, like I had to use things that were changing my frequency. So I started, because I mentioned this too on Instagram, but it was the static electricity. Like and I still get it. And so I started doing research before I knew that it was for sure Lyme. And I read lithium orotate can help like neutralize static electricity. So the only supplement I had was Gabatone, and it had lithium with a few other things. And this was before also I knew that my calcium had gone really high. And that was part of why my heart was going crazy. That like took away the static. And then every time it happens, I can take that and that lowers my heart rate. And it's mostly staying stable, but like it's not perfect yet. So that's one thing that my little crutch that I went to that helped me a ton. But the frequency stuff, like I've been doing like amp coil, but then and that was helpful, but PEMF helped me a lot as well. So I'm into the frequency stuff as well.
Yeah. I have a PEMF mat and
do you?
I lay on it every night.
Yeah.
Mm-hmm. Yeah, that was one of the things I made along the way one of the purchases I made along the way after the heart rate stuff. Like I knew I needed more like coherence with the frequencies I was around. And all my computers are hardwired. I try to keep my phone on airplane mode, but I live in a high rise in a major city. So there's only so much that you can do.
I know. It's like grounding mats and on our bed and you just try and do the best that you can. But definitely I feel better like up at the cottage or something because I'm in a high rise in Toronto and it's the same. It's a lot coming at you. So next step is getting out of here.
Yes, agreed. I feel like so many people are wanting to go back to those small little towns. Like that's where I was raised and everyone was fleeing, but now everybody's fleeing back there. Everybody's going back.
I know. I know. It's interesting to see. Sorry, go on.
No, I was going to say even myself, I swore I would never, ever go back there. And now I'm like, it's looking better and better.
I know. I didn't think I would ever want to live in a small town. And I've been spending most of the time up at my family's cottage because it's just, you need peace and like calmness now. Yeah. It's been a crazy 2 years. It's shifted a lot of people.
Yeah, for sure. And you're in Canada. So that brings me my next kind of topic is your practice and how you got started. I know you went to school for a chiropractor and you work with athletes, but do you see anyone else besides athletes or how does that work?
Yeah, we do. And we're growing the clinic as well. We do virtual. We can drop ship test kits if we're going to do tests. Like we use the Creating Balance Health scan as well, because I know that's a big thing that you interpret as well. And yeah, we just help people piece back their health through, we do it through a program, but it's because like I'm the type of person, and that's why I kind of made it like that. Like I need it, like tell me exactly what to do, like get me the supplements. So we like source them all if people want, and then we send it directly to them. So it's not like you get something here, something there, and then all the little hacks that we have them do. And we have them working with a health coach for when they're like actually introducing each supplement, because that can be hard for some people, or even just the lifestyle or the dietary changes. So someone to kind of hold their hand and have it kind of laid out. So it kind of came that way with the athletes in mind, because they really wouldn't do anything unless you were kind of doing it for them, but still empowering everyone, and then trying to teach them different ways to look at things, like, simple things like if you have a headache, like there's ginger and magnesium instead of so a little bit of green medicine switch from pharma kind of thing that's a little bit healthier. So yeah, we do that. And then we have different chiros that see a lot of the different, we're mostly working with NHL players, but we do like specific treatments for the vagus nerve. And we've really blended acupuncture, soft tissue, chiro in like these long treatments, right? We're not just we treat the whole body, because the whole body is kind of connected. It's not just a quick treatment. So even for that kind of in-person stuff that we do.
Yeah. So when you first were graduating, did you immediately start your own clinic, or did you join someone else's?
No, so I had a mentor in the field of sports chiropractor, and he's the reason that I was working with NHL players from pretty much while I was still in my internship at school. And it was a pretty interesting, like we worked with like royalty and like all of these like Hollywood and it was kind of crazy, but then you just see like we all just have the same problems. Like, so I worked under him for like 6 years before I just said, there's more I can do on my own. And I just grew away from him. And then, I just left a really busy clinic that I wasn't fulfilled with the way that they had it set up. Because if I wasn't traveling with my boss, we taught like acupuncture, we taught like a fascial course, we taught a lot. It was really, really fulfilling. But the actual like day-to-day in the clinic, I'd see like 30 patients, and then I'd go in the evening and see like 6 athletes. Like, so it was like an every 20 minute, like run into one room, acupuncture one person, go into the next room, assess acupuncture, go back in, take it out, do some quick stuff, go back in, next person's there. And it was all day long. It was talk about just like my nervous system being shot. Like, so it was never like a great setup for me. So yeah, I knew I wanted to do things different. So I kind of left and started from scratch, and it worked out.
Yeah, that's a big theme that I'm noticing with all the women I've been interviewing so far, is that you start out doing the crazy schedule and you realize, wow, this is not only bad for me, but it's really not good for the people I'm seeing either. And I need to figure out a way to see more or see less people and take care of myself and charge more.
Exactly. Yeah.
So when you say we at the clinic, what other kinds of people and professionals do you work with?
So we have massage therapists, physiotherapists, another functional medicine practitioner, and some health coaches.
That's a pretty decent team. Yeah. If somebody wanted to work with you virtually and they wouldn't be able to come in and do the like physical work, what would that look like?
Yeah. So we just try and we're trying to build that community. And I'm actually trying to like travel and train people and, come up with their own little course for like even the vagal nerve kind of release stuff or acupuncture. So we try and find someone in the area that's doing at least something similar for the actual like body work. And then, usually in like bigger cities, I do know someone that either like in the past taught acupuncture to, or know through treating some of the other athletes. And we just get them to integrate it that way.
Oh, that's awesome. Yeah. So you would find like a chiro in the area or something like that for that person?
Yeah.
So one of my other questions was kind of about Canada.
Oh yeah, go.
I know that how does it work with alternative medicine in Canada with like their healthcare systems? I'm not super familiar with if things are covered at all. Like I know in like Amsterdam, you
functional. Yeah, functional medicine is all out of pocket. Like some people in Canada have plans and they'll get like a few naturopath visits covered, but I'm a chiropractor by trade. There's people have like extended coverage for chiropractor. Chiropractor used to be part of our like socialized medical system, but they got the boot for whatever reason. So yeah, most people have like a lot of people have extended like insurance or coverage for actual chiropractic work, but the functional medicine and the programs are all out of pocket.
Makes sense. Same in the US.
I know they make it seem like if you want a certain care, like you always have to pay for it, like no matter what. Like, it's not like we have socialized medicine here. It's not good. It's not good care. Like,
right.
So, I mean, if you're in like, I went to the ER because I literally thought I was having a heart attack and I wanted to make sure that I wasn't, right? Like, other than that, I mean, they told me I was perfectly healthy after that. Like, it's 4 a.m. I'm in the ER. I haven't been to a conventional doctor in 15 years and I'm perfectly healthy at 4 a.m. thinking I'm dying. But, so you just use it for what it is and then find who you actually want to work with, who resonates with you, who kind of answers those questions or something that, oh, that makes sense. Like, like just like everything else, like it should be logical, like something is causing your body to have an irregular heartbeat already, or right now it's been beating normal for, 30 something years. Like, so, like, let's try and figure something out. And then if you research, the information's there. It just doesn't make it to the textbooks they use for 20 years or something.
Yeah. And if someone like you can be gaslit, I mean, no one's immune.
I was shocked. When you're like the one vulnerable and in the situation, like, even though I have like tons of knowledge and usually like I'm a pretty sassy like person, like, like I was just like, sad. I was like, and like, it's awful feeling. So, definitely shed a few tears after that because I thought I was more feeling bad for people that weren't going to be able to go home and figure it out for themselves or have all of these smart friends helping them sort it out. Right. Like, or be able to send for their own tests because I tested myself. Like I found Lyme, like, so it's just, you got to be your own advocate. You got to find someone that clicks with you, resonates, that, and it should always make sense. If they explain it to you, it should always make sense.
Yeah, that's a good point. I like how you pointed that out. So what are some of your like emotional coping skills for when these situations happen? Like crying, great, get it out. But then what do you do?
I mean, I've been trying around different things. I mean, for me personally, writing out my feelings is a good way for me to kind of release them. I've tried some hypnotherapy, which I found helpful, but yeah, I'm this person, like I talk to everyone and like I explain them how I'm feeling, like all my friends and family, like I'm kind of like an open book. And I feel like that's how I get it out and cope. Like I always don't know how people just hold everything in. I am just not that person at all.
Yeah, I was opposite. I was hold everything in.
It's not good.
No, it's not. It comes out in other ways.
Exactly. Well, something came out of me in other ways, but I think it's other things that I repress. Like, I think sometimes, and I think what comes up a lot this year is that like throat chakra, like I've got something to say and not being able to say it. So I've been really trying to do that. And it's empowering, I think. So, and it's hard. It's also hard, but I've always been the person like avoiding confrontation, avoiding this and just trying to be more like forward is definitely something that I'm kind of relearning because, I feel like every time you go through some sort of challenge with your health or something comes up that's like challenging you again, like there's just a lesson there again that you didn't learn the first time. So I think that's a big one for me.
Yeah, I agree with you. I resonate with that. A lot of codependency and people pleasing and don't rock the boat as well. Yeah. And now I'm starting a podcast.
Yeah.
To get my voice out there.
I love it.
It's one of my exercises.
Amazing.
So the question that I've been ending with and just asking everyone is a two-parter. One, what is your biggest lesson and also biggest win in life? And then the second one is the same question, only with business.
So, I mean, it comes back to what we were talking about. Like, I felt the whole people pleasing thing, like, and this might be for my personal life and my business, but like everyone else always came first, not like, what is it that I truly want? And, you know, in some ways I've always been a trailblazer, but then in other ways I've really held myself back. So I think it's just being true to what you actually want to do and not following like societal rules or anything like that. So, and I mean, I think that goes for business too, because then for me and probably you as a caregiver, like all of these people's needs came before mine, right? And I worried about them deeply. Oh, how are they feeling on that? I hope I don't want anything I gave them to do this, that. Like it was really like a lot. And I was working with like high caliber people, and it's like, oh, if something happens, and it'll be on the news, and kind of like, I don't know, like just like catastrophizing things too. So I don't know, just like being genuine and true to yourself, and always just coming from like a genuine place. And, you know, people will like come to you. It doesn't have to be like you like grinding it out all the time is something that I, you know, wish I knew about even the business side. You just like be the flower, not the bee. Do you know what I mean? The bees come to you. You're the flower. Yeah. That kind of resonated with me.
Yeah, that's a perfect analogy. So I am so thrilled that we got to have this conversation. If you could just let everyone know how to find you, how to work with you.
Yeah, so we have our website is vegusclinic.com, also healyourgut.com. It all goes to the same place, but there you can book like a discovery call. You can download like just like some simple vagal nerve. We called it vagal nerve toning, but activating, whatever you want to call it. You can download that on the site. I'm also on Instagram, Dr.S Canestraro. I have to change it because it's just Dr.S is my name, Stephanie, and then Canestraro, my last name. So that's my Instagram. And then we have a Vegas Clinic Instagram, and that's where we're most active. Not on our Vegas Clinic, but on Instagram. I'm overwhelmed with too many social medias. Maybe I'll start making some TikToks. I don't know. But thanks for having me on. And like, I'm so thrilled. And honestly, like, I mean it, and I feel it with you, because like when I see your posts, I just feel like they're genuine. I didn't know what the cortisol.
Topical steroid withdrawal?
Yeah. And I mean, I've been on corticosteroids like a lot and in the past, because always eczema. But I learned that from you. I'd never heard of that before. And just like, yeah, everything that you post really resonates with me as well. So
thank you.
Thanks for having me on.
Yeah, of course. I'm thrilled. All right. Well, thank you everyone for listening. EMFs, electrosmog, and geopathic stress are an increasing problem in today's world. As someone who lives in a major city, one of the ways that I help lessen this kind of stress on my body is with a Soma Vedic. Soma Vedic is designed on the principles of controlled release of energy from precious and semi-precious stones and metals such as platinum, palladium, gold, and silver. This creates a coherent field more than 2,800 square feet. It's an Eastern approach to wellness combined with Western frequency therapy technology, and this puts Soma Vedic in a very unique device category all on its own. It helps with mitigating negative effects of EMF, radiation, including 4G, 5G, Wi-Fi, geopathic stress, Curry and Hartman lines, oxidative stress, and free radicals. Soma Vedic also structures water and changes it into mountain quality spring water that is natural to our bodies and cells. It can structure and harmonize any tap water or bottled water. It provides water in its most natural state, just like nature intended. And you can harness the benefit just by placing your water jug next to Soma Vedic. You can check out somavedic.com, and for 10% off, you can use my code PANACEA, PANACEA.